Welcome to Bite Size Dental Marketing. Today we have the amazing Dr. Ashish Mehta here. Doctor, thank you so much for joining us. Dr. Mehta, affectionately known as Dr. M, is a dedicated dental professional out in Calgary, Alberta, in Canada. Dr. Mehta holds a Bachelor of Science degree from the University of British Columbia, earned in 1998, and he furthered his education when he obtained his Doctor of Dental Medicine from Temple University, Kronenberg Dental School in 2004. Dr. Mehta has also completed advanced educational programs in TMJ, which we're going to be talking a little bit about today, dental rehabilitation, and he's also very passionate about managing TMJ pain and fixing smiles with advanced dental techniques that he has learned through the FACE Foundation for Advanced Education. Dr. Mehta, again, thank you for being here with us today. It's lovely to have you.
Thanks, Ian. Thank you. It's great to be here. And I love how you said Kronenberg. I didn't realize that's how it's probably pronounced.
Yes,
That
that would actually be the Afrikaans. Kronenberg is how we would say it in Afrikaans.
Okay. I
Yeah.
like that. I like that.
So it's funny, actually. I wonder how, I need to go look at that, how um, it ended up being named Kronenberg, because you wouldn't expect that uh,
No, and I
from
can't
Northern
remember when I
America.
went there whether or there was sort of during that time. I think they were changing the name. There's a bunch going on, a bunch of things going on when I went to school there, and so I think they may have changed the name at that time.
Okay,
Yeah, but I
interesting.
wasn't pronouncing it as well as you were. That's for sure.
So, Doc, one thing that stood out to me from the start when I met you originally and we started having discussions is you kept repeating something to me, and that is, I'm not just another dentist, Ian. I do things different here. I'm not a factory type of dentist. I don't do that. Please remember that as we embark on this journey together, and you joining Pain-Free Dental Marketing. So I want you to just share with the community today what that means to you and why that is so important that you have decided to approach dentistry differently.
Yeah, that's a great question. I guess my approach, and I'm sort of looking at the medical model, and so I'm in Canada, like you mentioned. So our model is a little bit different than maybe what you would see in the US, especially from a medical standpoint. Um, we are we have universal medicine, and so that way, there's a difference in the two. Dentistry is becoming very similar in that it's becoming sort of a factory based model.
Mm,
And
mm.
and I noticed this when I studied in the States and worked in the States. And when I moved here, I thought it'd
Especially
be a little bit
with
different.
DSOs, seeing more and more DSOs moving in
Correct.
and
Yeah,
dying out. You're seeing
absolutely.
it more
And
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 more.
and we're and when I started this journey here, there weren't as many in Canada, and now you're seeing that pick up. I mean, the
Mm,
rules are a little bit different, so I think that's probably why. I know in the States it's huge. And so I just found that the model here was all about kind of, I guess, drill, fill, and bill for lack of a better term. And the dentist would pop in, and now there was no opportunity to sort of build a relationship. There's no opportunity to get to know the patient. And that just didn't resonate with me. I just didn't feel like that's the kind of practice I wanted. And so I sat down and really decided, okay, what would I want if I was looking for a healthcare provider and
mm.
I wanted to have a place where I could call, my dental home, what would I be looking for? And that was the first thing for me was connection and small. And so for me, that was the only way I felt that I could do quality dentistry for people and connect and build relationships. And so that's what I decided to do, is just build a small practice, a 2-chair practice where I work out of one chair and we have our hygienist working out of the other chair.
Mhm.
And that way it just allowed me to focus on the dentistry, focus on the quality. I wasn't popping in and out. Patients got to spend time with the dentist, which a lot of patients don't get. They barely see the dentist, just kind of pops in and out with a mask and says, "Oh yeah, everything's good," and then pops out, right?
Yeah.
And that just didn't resonate with me. So for us, it was keep it small, keep it personable, spend the time with people, and just do what's right.
And when you say how you do things in the practice on the patient journey and you spending time with them, can you give us a little run through of what a patient would expect if they would come to the Reflection Dental Group and that personal approach that you just mentioned?
Right. Yeah. Well, usually by the phone call, for sure, you'll usually get Michelle, but if she's busy or not able to answer and I'm available, you might even get me answering the phone. That's sort of part of that personal touch. As a new patient, we really want to get to kind of know you, and a lot of times we offer just a meet and greet. Hey, come on
Mm.
in. Let's hang out, with no commitments, no financial commitments, and get to know us, get to know our
Become
philosophy, get
comfortable
to know
with
what we're
me.
about. Yeah.
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 It's like you meeting someone before you go to coffee or something. You want to kind of get to know them a bit, before you, I guess, start dating. Hey, let's go for coffee and get to know whether this is even worth spending and investing my time. So let's meet
Yeah.
before we do any of that. And so I think for me that's been great. And then patients get an idea. They realize, okay, there's something different about this place, right?
Fantastic.
From our exam, uh, I feel the thoroughness of our exam lets them know that, hey, we're here to help you with whatever concerns you have, but also educate you on things that maybe you didn't know was going on, and try to make those links. Like a lot of times you get patients who come in and say, well, this is going on, this is happening. And then we're able to sort of pull it together. And all of a sudden there's this aha moment of, now I understand why that tooth is now cracking and why my jaw is feeling like this. And then why I've been doing this and they've been popping off. So there's a lot of times we're able to make those connections, which then help the patient understand more about what's going on with their dental
Mm.
health.
And over communicating, I've seen that's one thing that very often dentists um, that I've worked with fall short, or even in my personal experience when I would speak. I mean, I mentioned to you, my father's a dentist, and he would always say to me, um, my son, the biggest problems I run into is when I don't over communicate and I don't explain to them exactly this is why this is going to happen, this is why we're doing this, and how that affects. So it's really nice to me to hear that you're saying that, because from personal experience, I've seen how important it is to communicate, to spend that time with the patient, to make them
Yeah.
feel comfortable.
And give them an opportunity to ask those questions. And I've got such a strong team that if I walk out of the room and I've used some dental jargon and the patients kind of look at, they know exactly what I'm saying, and they'll be able to explain to the patient, okay, yeah, this is what Dr. Mehta was going on about with that
Okay.
particular comment. So, that's great to just have that team as support.
And part of having the more refined approach that you're explaining now, I know one thing you've also shared with me is the type of treatments that's important to you, that you focus on, that you want to do. Of course, you do many types of dental treatments, but I know something special to you is TMJ, and that is something you're really passionate about. Can you share a little bit about why you're so passionate about TMJ and treating this when it comes to your patient base?
Yeah, absolutely. So when I started this dental journey, I've been practicing for 5, 6, 7 years, and you don't learn about TMJ in school. It's just not something that's taught. And so I would have cases and I would do work the way I was taught, but I've just found that they weren't turning out the way that I felt they should, and I'd see
Mm.
failures and I couldn't understand why. And that started my search on this journey about, okay, why are certain things working and certain things aren't? And it was in 2010 that I discovered the FACE Foundation, the Foundation of Advanced Continuing Education out of California. And that just opened my eyes to, and just explained and gave me so many answers to why patients were having certain issues and patients were having certain complications and discomfort and pain, and why whatever I was trying to do wasn't working. And that was huge, because all of a sudden now you just see with a different set of eyes.
Mm.
And that really helped bring answers into a lot of the questions that we had of why things were failing or why patients were uncomfortable. So that's sort of started my journey with TMJ pain.
Mm.
And that's a huge part of what we do. Everything we do, even if it's a single crown that we're doing on a person, even if it's a filling, we understand that that filling for certain people can trigger a whole cascade of issues if you don't recognize that early on. And that's not something I knew early on in my career. And now it's been huge and
And
huge.
do you think a topic that I've heard more and more and more as I speak to dentists across the board, and this is just, I'm saying orthodontists, prosthodontists, dentists such as yourself, across the board, this theme of I can't just do anything because what impact is it going to have? It's something that people are waking up to. Because
Right.
when I think back to I'll use this analogy, your grandfather's dentist, I don't think that was something that was being spoken about. It wasn't like, hey, if I get Invisalign and I force my teeth into place quickly over a period of time, what does that do to the alignment of my jaw? What does that do for TMJ issues? What does that do? Because I know it runs all
Right.
the way through to the spine, to the rest of the body. It starts in the mouth. So,
Absolutely.
what have you seen, or what's your experience been with treating TMJ and the impact that it has on the body as a whole from cases that you've treated?
Well, the jaw joint is such a complex. It's probably the most complex sort of mechanism in the body, just the way it moves, and of course the connection to how close it is to the head, the face, the ears. So it can affect a lot of things.
Mm.
People feeling dizziness, people getting headaches, people getting popping, clicking, all these things. That if you can make that connection, and for sure, it's not always what came first. Was it the jaw pain that led to some other collateral issues, or was it vice versa, right? Sometimes it's hard to tell. But if you're able to help manage this discomfort, you can at least allow the patient some relaxation that they can address some of the other issues and see if they're connected, right? And sometimes we found that as soon as we were able to get the jaw to the right position and the jaw to relax, the rest of the body was just able to just relax,
Mm.
and you don't get that all the time, but we've seen it for a number of patients.
I think what a lot of patients struggle with is how does this happen? What is going to happen when I walk through the door? Because TMJ has become a buzzword and like, oh, I'm clenching my jaw, TMJ, I have this, but I think very few people actually understand
Yeah.
how it is treated, what happens, and how it's going to help you, and why it helps you when that is done. Can you
Right.
take us through just the procedure and the process, kind of the what happens chemically, and then why it's going to help the body?
What I've been reading about and learning about is that a lot of the TMJ issues start from a very young age. And this is
Mm.
where some kids have had some trauma, have had something that has caused the disc, which is designed to sort of protect the jaw joint, to either move or to break down. And as a result, either the jaw doesn't properly grow, or later in life, that disc decides, hey, I'm done, and slips away and moves out of place. So this in turn leaves this jaw joint kind of bone to bone, which is not the ideal relationship. And so as people get older, and unfortunately we see this a lot more in women than in men. I think I'd say in our practice probably 70% women who are the ones who come
Wow.
in with jaw pain. I think a big reason for that is hormonal laxity. They're designed to have a little more laxity in their body. And so that disc is not necessarily held in place as readily. So if
Mm.
something happened in a young age, now there's that trauma, but also that disc can move easier. And so our approach is conservative. There's all these approaches of surgery and trying to rebuild the disc and all these things that I've read about and sort of seen, but there's no true tried and true method of fixing this. And so we always start conservatively. And that's by identifying the issue. Is this truly something caused in the joint? And then we look at making an orthotic, a very conservative orthotic, to see, is this going to help this individual? And then
And
that's how we work. And then we work with other specialists to say, okay, how are we going to resolve any discomfort that's not necessarily being resolved by what we've done so far?
and is it treatment? I know there's TMJ treatment by Botox, is all of that. So what's the kind of procedural? What's the procedure in your practice when it comes to treating TMJ? Is it similar? Is it on the Botox side? How does it work?
No, yeah. So I haven't treated TMJ with Botox. My only concern is that we're essentially weakening that muscle. And I get, a lot of these muscles can be very tense and overworked. And so Botox sort of turns them off. I feel like in doing so, then you still have to be able to move your jaw and stuff. So then you end up recruiting other muscles that maybe have to overwork. So I rather try to figure out, okay, what is the etiology? What is the cause of this? Is it because of the patient's bite? You know, and being a dentist, that's really my main focus is, okay, is this because of your bite that's causing this jaw issue? Or is your jaw issue causing this discrepancy in your bite? You know, again, it's kind of that chicken and egg situation. So we don't use stuff like Botox, injections. We mainly focus on, okay, let's do something that's irreversible, something like an orthotic that we can figure out if in fixing your bite, we're going to help manage this tension and this discomfort that you're having in your jaw joint.
And when you say to fix the bite, is that would you build one of the teeth up more so it connects better? Would you use a type of device? Like, tell me more about that, how that happens, and how
Yeah, no,
you
great
say how you
question.
fix the bite.
Yeah. So essentially with the orthotic that we design it to almost trick your brain into thinking it's got an ideal bite.
Oh, wow.
So when your teeth come together, your brain is like, oh, wow, okay, finally someone's fixed this bite magically. I can stop having to recruit all these muscles, have all these muscles firing unnecessarily. Again, it's something that you just wear at nighttime to help to see if that works. Because if you wear it longer than 12 hours, 12 hours, you're going to start seeing permanent change. So we just have you wear it at nighttime. And then we assess. And if we start seeing change from that, then we know, perfect, we're on the right path. And then we talk about, okay, getting your teeth in the right place. It sounds like your teeth are a big part of this issue. They're in the wrong place. We got to get them in the right place. This is what we need to do to get you there.
That's interesting to hear, because I know, as I said, Botox has become such a hot buzzword in we treat TMJ with Botox. And I have wondered if it's a plaster, because of course Botox dissolves, so
Yeah,
it becomes more of a Band-Aid. Although
correct.
it does have its place in the dental field. I 100% support that, and if that's going to provide relief to people. But I've personally always been I want to solve the problem. I want the root cause. I want the problem. I don't want to put a Band-Aid on it, because I'll have to deal with it down the line again.
Exactly. Yeah, and I feel that Botox, like you said, and we do Botox for cosmetics. We don't do Botox for therapeutics, like what you're talking about, the jaw pain and but exactly, we want to figure out the root cause, because you can keep injecting with Botox, but every 2-3 months you're going in for injections, things are wearing out. And what's going on long term with that muscle that continually gets injected, So we don't know. I don't think we know. So for us, it's, let's do something that's reversible, that is not going to cause any change, but that we can then assess the situation.
Great point. And tell me, do you feel, as someone that's seeing so many TMJ cases and people coming in, what are some of the most common misconceptions that you've ran into? I know one is that very often people don't even know how much they're clinching. I mean, I would catch myself at the end of the day just going, yo, something happened, and then I'm like, okay, I had a lot of meetings that day. It was an overly stressful day, or I did
Yeah.
something, but I would feel it. But there's confusion and there's misperceptions. So what are some of the ones that you've ran into at the practice with patients that maybe say something to you and you go, no, actually no, that's a misconception. That's not how it
I
is.
think, yeah, no, that's a great point. I think the biggest one is probably when we meet a new patient and they come in and they open and we can hear a pop or a click, or that's part of our questionnaire is, do you have any clicking or popping in your jaw joint? And a lot of times they say, oh yeah, I've had this for years and my dentist said it's okay if it doesn't hurt. And that's where I think as a profession, we've kind of dropped the ball, because as soon as you hear something pop or click, there's an issue in it, and it
Yeah,
should be looked at. If we walked around and every step we took, your knee clicked or popped, you'd be
you're
getting
gonna
that
check
checked
it
out.
out. Yeah.
Absolutely. But the jaw joint, for some reason, I think as a profession, we're not as comfortable addressing it.
Mm.
So if there's no pain, we're just like, you're okay. That happens. And as soon as you get a pop or click, that tells me that there's been a disruption in the jaw joint. And so now we have to assess that and figure out, when did this start? When did this happen? When does a pop occur? Does it happen when you open? Does it happen when you close? These are all just different pieces of information that allow us to hopefully get more information of what's been going on. So that's the biggest one, is that, oh yeah, it's popped and clicked. Every time I eat it clicks. It doesn't bother me. And that's the concern, because it doesn't bother you, it's okay. But to me already there's already been some issues that we
Yeah,
got to look at,
some damage.
some
So to
damage.
summarize
Absolutely
that, I would say it's, if you're starting to feel something, it's better contact your dental provider. Like don't wait until it's a train smash.
correct, correct.
Deal with the
And contact
problem
the right
early.
person, because your dentist might say, oh, if they're not comfortable with addressing TMJ and dealing with TMJ, they might be okay. No, you're okay as long as it doesn't hurt, right?
Mm,
And for me, I feel that's the wrong thing. We got to really look into it and understand, okay, why is this happening? And give some options to slow down the progression of it.
of course. No, thank you. That's good to know about TMJ. I want to also talk to you about cosmetics, because I know that's another topic that's important to you at the practice. Tell me a little bit about some of your favorite cosmetic treatments that you're offering, and why, and then we can just kind of dive into each one as we start talking about it.
Right. Yeah. I think cosmetics. We've had the opportunity to do some lovely cosmetic cases. That what I love about them is how the person on the other side just changes. One case that I think of is we had a gentleman who came in who had worn down his teeth pretty much to nubs, and so you can see his teeth, and he had this big mustache here, and when he smiled, he didn't have this confident smile. And so we chatted. His was also a functional case. He was losing function. He didn't have front teeth to eat with, and so we discussed rebuilding his teeth and giving him a lovely smile, and we did that for him. And then the next time I saw him for what we call a recall to check his teeth, all of a sudden I'm like, there's something different about him. I'm like, I didn't recognize you. And I realized he shaved off his mustache.
No way.
And he'd had that mustache for almost 40 years. Like his kids
And it
have
was a
never seen him
cover up.
without the mustache. It was
a
a cover up.
cover up. Yeah.
It was a cover
Yeah.
up because he was embarrassed about what the teeth looked like. And so he grew this mustache. And so that has always stayed with me. I'm like, that was so powerful. And then patients who've come in who said, hey, I just don't smile in my photos. I want to smile with my children. I want to take these lovely photos that we can look back at. And I just don't smile because I'm not confident. I'm embarrassed about my teeth and how my smile looks. So we love doing that. And we have a process where, again, it's a reversible process, which is awesome, where a patient comes in, we chat about what they want to get done, what that looks like, and we help do some design work. We work with some of the top labs, which is important. You need to work with a very high quality lab in order for this stuff to look awesome and real.
To look great.
And I'm sure you've seen it. There's tons of stuff out there that I look at and some people like, but I look at it going, God, this just looks like chiclets. Like it's horrible. I would never want any of my patients to have this on their teeth.
I always
But
think about Ross in that Friends episode where he went to go do the teeth whitening, and she turns on and he's smiling, and it's just like it looks like a toy. It's almost like someone has a toy in their mouth. It's such a weird.
I don't know if this is a trend where you are, but I know in North America it is a huge, just to get it as white as possible. Toilet bowl white. They want people to see it, from a mile away, which is fine. But then when you look at the actual teeth, you're like, but these aren't even healthy. These aren't even going to be healthy for the gum. Yeah. These aren't even going to be healthy for the bite. So that's the concern. So for us, it's always about, it's got to fit. It's got to be functional, and it's got to be aesthetic. Our goal is that when people look at you, they're like, wow, something looks great here. What did you do? We don't want them to pick out and say, oh, I love your veneers. Like, those are great. That's not our goal. Our goal is to have it imperceptible, but for you to gain that confidence to be able to smile and know that, hey, I've got a beautiful smile now, I've got beautiful teeth. But we don't want other people to know that that's what you've had done. So that's kind of our way of practicing.
That's such a great point.
We get to do a trial smile. Yeah, we do a trial smile for people. So they come in, we actually fit the teeth with the right shape and a color, and we take some photos. We do like a little photo shoot, and then they get to see what it looks like before we even do anything.
Fantastic. So that takes out the guessing game.
Takes out the guessing game. We pop it off. They don't, they can take the photos home and show the family if they want, but we pop it off at the end of the appointment, so they're back to what they had coming in. And that's a great way for us to get for them to get a feel of what it's going to look like, feel like, how they're going to feel, their smile. People's smiles change as soon as I've seen it so many times that they'll smile a certain way and you get them to smile big and they don't. And as soon as you change that landscape, all of a sudden their smile just brightens up. So
Yeah.
and that's a fun part. So that's what we do. We work with, and we're conservative. I look at a lot of these dental photos on Instagram and TikTok, and my stomach drops because these people's teeth have been filed down to like nubs. That's never coming back. So for us, it's about can we do conservatively with minimal adjustment of teeth, but get an amazing result. And you can only do that if you have the right team, if you have a technician who can do beautiful porcelain work, but with very little space. And that's a dying art, unfortunately. We're moving towards machines,
Fast. Yeah.
CAD/CAM, scanning, quicker, and the art of being able to take porcelain, layer it, and have such a thin veneer that goes over the tooth that's almost imperceptible, almost like a contact lens, but that will change the shape, color. That there's not too many technicians who can still do that art.
And what's your opinion on 3D printed veneers?
I haven't seen too many 3D printed veneers. So we haven't jumped onto that technology yet. The reason is I still talk to my technicians and I ask them, look, what are you guys finding? Like they're finding it's getting better and better all the time.
Because that's more so my question of how does it, from what you've seen, that the handiwork of a technician that you just said now, and that creativity, because I know it's an art for these technicians. The lab, just like you're an artist as a dentist, for the lab, they are being artistic in creating this tooth.
Correct.
How close are we getting to recreating that with a
They're getting there.
printer?
You still need the technician in there to do. You need someone who understands the art to do the final detail work and to really make that tooth a tooth. We still use analog impressions, and in the end, I mean, the lab can only give the dentist what they get in. So if they get beautiful molds and impressions in, they can do beautiful work. And a lot of the labs say that the analogs are still a little more maybe detailed, a little more, the fit sometimes a little better, but again, CAD/CAM it's printing and scanning. It's getting better every day. Like every day something comes out. So it will eventually be to the point where I think it'll be at par. I personally don't feel it's quite there yet, and so I'm not investing in that technology yet. But it'll be there for sure.
Because I know a big thing, I remember something that stood out to me when we had first met was you said, I test out things over and over again before I decide to bring it into my practice because I need to make sure that it's the right thing for my patients. So that's always why I wonder about this, like how many dentists are there that's not just, okay, it's a new technology, but actually going like, okay, I'm going to compare this to this and then actually try it and then see, okay, no, this one is actually still better so that I can protect the end product that I'm providing
and
my
that's
patient.
hard. I mean, like any industry, dentistry, there's a lot of marketing that goes into it. So we have reps every day coming in saying, hey, here's the latest and greatest material. And, it comes in the sexy packaging and it looks awesome. And they tell you how great it works. But in the end, for me, it's like, okay, if I'm not going to put this into my mouth, and if the stuff I'm using now works and works really well, I need something that's going to either work better or at least reach that level.
Reach that level,
and I'm not willing to use my patients as a testing ground for that. And so, I wait at least 5 years before something's come out, read the research, talk to my mentors who are also conservative like myself. And once all that kind of fits what we're looking for, then we look at introducing that technology. So the stuff, I mean, and we have technology, like there's stuff here that I wouldn't be able to practice with if I didn't have, but we want to make sure, hey, that's something that's going to work for us and our patients before we even introduce it.
And speaking of mentors, I know Jeff Brucha is one of your mentors or someone who you've looked up to very much. Can you share with us some things in dentistry that that he had taught you that you carry with you to this day and that's influenced your practice?
Oh gosh, yeah, Jeff is an amazing mentor for myself, mentor and friend. I've not met someone who is just so true to their values about dentistry and who always wants to do what's right. for the patient,
Mm.
and he is, he hangs out with the top dentists in the world, and yet he will always be true to his way of practicing. And he's got a similar philosophy. It's a small practice. It's got a couple of chairs, and it's all about developing that relationship
Mm-hmm.
and doing what's best for the patient. One of the things that Jeff has talked about, and Jeff's mentor Tom Basta, is that it's important to strive for perfection and fall short than to strive for mediocrity and reach it. And that's always been something I've kept in my mind. It's always great. You got to strive for the best, and yeah, you may not always get there, and a lot of times you won't. But if you fall short, it's better than just to strive for the basics and just get by and actually attain that. So that's been a huge part of what Jeff's mentoring has taught me. And just not listening, not believing everything you're told. Do the research, look at it. You got to look at it yourself and talk to the people who aren't being motivated by money.
Yeah.
Because money's
And
a big thing.
by
When money
dentistry,
talks, the truth is silent. That's the other thing that Jeff has taught me. When money
when
talks, the truth
money
is silent.
talks,
So
the
you got to
truth
look.
is silent. Yeah.
You got to, and you can use that saying in all sorts of different scenarios, right? Whether
Mm.
it's politics or financial or.
Because I do see, I mean, there is, of course, running a business, like, of course, dental practices are for profit, and you need to feed your family. There's people working for you, there's stuff. But I agree with what you're saying on, I'm seeing more and more that dentistry is becoming this, like, it's a corporate machine, and that's why this DSO move. I'm on record for saying I'm not a super big fan of this
Right.
move with DSO, because I think it's very difficult to maintain the level of product and excitement and personalization, care, everything that you've spoken about today. It is difficult. Just think of franchise. Think of McDonald's. You're not going to get the same McDonald's burger. You're not going to get the same whatever at every franchise store, because it's so difficult to maintain that quality.
Right.
And
And I think McDonald's could probably do a better job than, because that human factor has been taken out, right? The
that is
quality, the
true.
burger's a
That is
burger. So
true.
we're here, you're getting a different set of hands, a different set of experiences. But the beauty of a and that maybe for some people is convenience. You know what to expect. Usually you know what you're
Mm,
going to end up paying, right? And for some people, that's what's most important is convenience, late hours or weekends, and the cost. And so they're willing to sacrifice other things for that. And so I think that model works for some people. I think for me, it just didn't. And it wouldn't be a place that where I, like yourself, would want to get my work done or my dentistry done.
correct. That's the same thing for me. What I always think back to is I get it, but I wish that there was more of the passion side of dentistry and trying to achieve that excellence and this amazing craft, which I know most dentists, of course, strive for, and they do. But as you said, when
Yeah.
money starts to talk, and this conveyor belt starts to run, and the bank, the monthly collections is just going boop 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 boop. Like, at some point you go, I'm doing great. This is fine. But you stop to think. You don't think as much anymore about, is this the right the right treatment to use here? Is this the right machine?
Right.
Should I be trying this new thing if it's maybe worse than the existing machine I have that's 10 years older, but it's a better product for my patient? Like that goes out the door. It
Do
goes
I
out the
want to use
door.
this lab? A lot of them have partnerships with certain labs because they're charging a certain amount, but that may not be the right lab.
Mm,
It's like anything. It's like you get your haircut. People choose to go get their haircut with someone because of that person's experience, what they like being there, they like what the person's going to be able to do. It's predictable. That experience isn't always there with lab partnerships and stuff. So yeah, and now you're going in drilling, you're amputating people's teeth, drilling away, that's not coming back. For me, it's like I want to be with someone who really understands and who's on the same page and who's conservative and wants to do what's best, who do the exact same thing in their mouth that they're going to do in my mouth.
amazing.
That would be the big
Doc,
piece. Yeah.
Dr. Mehta, before we go, I am in Calgary. I'm looking for a dentist. Why should I come to Reflection Dental Group?
Why? Well, one, we make a great cup of coffee. from an espresso machine. I know you like coffee, and so yeah, for sure. We've got a beautiful view of the mountains, and we care. Like my whole team cares. We're not in this because hey, it's a job. Um, Everyone who works with Reflection Dental Group is here because they love to be here, and I see it daily. Like I listen to conversations that my team has with patients, and they're just connecting with people, and they're having chats, and there's laughter, and so for me, that's huge. I love. We have time. We have the time to spend with patients to get to know who they are, what's going on, and to make sure we're the right people to help. Like we know we're not for everybody. We get that. In
Mm,
fact, we're probably for a small group of people who value quality, who value time, who want to be able to have that consistency with someone who's going to do good by them. And so that's not everyone, and we get that. So that's the person who'd be like, hey, come visit us, have a cup of coffee, let's chat. And
mm.
if dental health is important to you, we're passionate about dental health. We nerd out on this stuff. We'd love to be able to help you.
Fantastic. Well, Doctor, on that note, thank you so much. I appreciate you chatting to me today. I love your approach to dentistry. I think it's something that a lot of dentists can take a chapter from your book and how you look at this. And to anybody out there in Calgary, I mean, if you want that Rolls Royce experience and somebody that's going to take care of you, that's going to listen to you, I mean, today's talk definitely showed that that is the type of person you are. So keep on keeping on, and thank you so much.
Awesome, Ian. Thank you so much. It was great chatting, and I look forward to hearing you sing next time.
We'll get there. We'll get there.
Okay. Take care.
Thank you. Bye.
Thanks. Bye.